I respectfully request that you adhere to that. Good evening, everyone. Welcome to tonight's meeting of the Mansfield Board of Education. My name's Kathy Ward. I'm the board chair. I'd like to call the meeting to order at 6:30. Jill, could you call the roll, please?
Certainly. Susanna Everett.
Here.
Martha Kelly. Edith Allison.
Here.
David Latrico.
Here.
Catherine Paulus.
Not here tonight. She has to work, I think.
Jeanette Picard.
Here.
And Kelly Zimmerman.
Here online.
Great,
Thank you.
All right, before we begin, I would like to thank everyone who contacted the board about the masking issue. We greatly appreciate your input, we really do. The purpose of tonight's meeting is to determine what mitigation strategies are necessary in this phase of the pandemic, including continuing or ending the use of masks in our school. As you all know, the governor has stated masks will not be mandated statewide after February 28, but individual districts now have the authority to decide to extend the mandate or take no action. Of course, masks will always be optional. I'd like to start off with an update from Superintendent Lyman on our current practices, including mitigation strategies, what happens when there's a positive case, what our current numbers look like, and so on. So, Kelly, can I
Sure.
turn it over to you?
Yep, you may. Okay. Slideshow, maybe? Oh. Yep. Good. There you go. Okay.
You're very popular.
Good? Okay, thanks. Okay, so just to give you some background, it's been a wild couple of weeks since the governor announced his intentions to first request of the legislature that certain of his executive orders be extended, and then to make a recommendation about when schools might stop using masks, or allowing, I should say, it to be a local decision. And so there's an awful lot of conversation that's happened back and forth about what the legislation is allowing or requiring, and what our role as a local entity is. And I think I think the dust has settled, and we understand the intent of those early press conferences a couple of weeks ago. On February 18th, which was last Friday, we received guidance that was written jointly by the Connecticut State Department of Education and the Connecticut Department of Public Health. And I wanted to make sure that you were aware of what the title of that document was, because I think it says very clearly what the intentions are of both these two commissions and the governor's office itself. And that is to transition to a model of routine respiratory disease prevention and enhanced outbreak management and control for COVID-19 in pre-K to 12 school settings. And it's a long title, but I think it is important for us to consider that the changes that are being made in the guidelines are intended to help us all learn how to live with this disease. The question is, at what point do we reduce or relax or remove some of the practices that we've been engaged in? And throughout these last several months, especially in this school year, we have found that some of the things we were doing last year were no longer necessary. We've learned a lot about how to mitigate against disease spread. We've implemented several practices that have been very successful, and we've also found that there are places that we can back off our practices a little bit so that they're not quite as restrictive. Quarantining and identification of students who may be close contacts was the most recent one, and it's had a positive effect on the students in our school and not a negative effect on the health of our students. And so I think as you consider your actions tonight, you do need to think about the fact that this is a virus that's here that we're all going to be living with, and our need is to consider how to keep everybody safe as we go through the step down, if you will, of trying to live with this disease. So the reason that this report was put out, and the reason that these commissions are suggesting a transition to a model of routine respiratory disease prevention, is because of these suggested rationale or included rationale in that report. That first off, there's widespread availability today of vaccines, very different position than we were in a year ago. Although I should mention, and I know this isn't lost on anyone, that vaccines are only available for children as young as 5 currently, and we do have 3 and 4-year-olds, certainly in our schools and in our homes as well. Another element of the rationale is the availability of at-home testing. And I think you're aware that we've even had test kits made available to us in schools to distribute to families. We have a third distribution of test kits. They were due to be picked up tomorrow, but because of the storm, they're going to be picked up next week. And I'll be communicating to families in the coming days about making more test kits available to families directly from the schools. Another element of the rationale is treatment medications. I think we're just starting to see the benefits of some of those, but certainly the drug manufacturers are finding ways to treat patients once they have contracted COVID-19, again, in ways that weren't available a year ago. Falling case counts, and I have some data to share with you that illustrates our own case counts. And then our experience with these what we call layered mitigation strategies in schools. And that includes things like our spacing protocols, our ventilation practices, the use of masks, certainly, and the ways in which we are notifying and making families aware of any possible contacts. I know a lot's been said about ventilation, and so I did want to mention somewhere this evening, so I'll do it here, some things about ventilation. Our middle school had a completely redesigned HVAC system within the last 7 or 8 years. It is of the highest quality of air filtration and circulation, other than what you might find in hospitals. And so we have no concerns with the ventilation at the middle school and no need to increase airflow by doing things like opening windows or keeping doors open. And we have monitoring systems so that we're continually monitoring that airflow to make sure that the system is working as it needs to. And in fact, in a couple of rooms, we've made some adjustments to make sure that the airflow is working as it should. Our elementary schools, of course, are a little bit different because of the age of those schools. They are not schools that we could install the sort of system that we have at the middle school. But we do have other strategies. And things as simple as keeping the classroom door open allows for airflow in the classrooms, and so does cracking windows. And so teachers have used those strategies throughout this time to increase airflow. So the report goes on to say, or the guidance goes on to say, that therefore, beginning February 28th, communities can begin to transition from a pandemic response to a standard public health approach to management and control of respiratory viral diseases. They're talking about shifting our focus from responding to individual cases to responding to case clusters and outbreaks. They're suggesting that we continue to recommend vaccination and booster doses, that we follow still all of the isolation guidelines for people who are experiencing symptoms or develop COVID-19, that we, following an illness, make sure that anybody in the school environment continue to self-test and wear a mask through 10 days, and that we continue to report cases, that families continue to report cases to school personnel, and we in turn continue to report those cases to the Department of Public Health. And also important to remember that all of the guidance that we've been provided along the way differentiates between experiences in the general community and experiences in school. In school, we can contain the environment much more so than in the general community. And so while we are not requiring students who have had exposures in the school to quarantine, we do still require students who have had exposure outside of school to quarantine. And they're saying that that should continue as well. But they are saying, as Kathy mentioned, that after February 28th, it is a local decision whether or not to make masks required or optional. So when do you make the decision to transition and to step down again from the practices that you're employing right now? The guidance goes on to say that you need to look at data on community and school district prevalence and transmission. I'm going to share some data with you after. That you consider your own risk tolerance for the possibility of increasing case numbers. Meaning, are you as a community comfortable if you step down with having a few more cases than you do now? And I think I'll pull it a little bit further down. Are you ready to respond should there be a surge? They also tell you to look at your current vaccination status, making sure you have plans in place to support any members of the community, your school community in particular, who are at the greatest risk for COVID-19, and have plans in place to support students or staff who wish to continue mask wearing when it becomes optional. Along with that is the need to continuously manage your risk assessment and be ready to make quick decisions when you do see a change in conditions. So let me give you a little bit of the data now. So I'm going to share with you the case count data first. I want you to keep in mind that we receive case count data every Friday morning from Eastern Highlands. Those data that we receive on Friday morning are for the previous week. So all of the data that I have is now almost a full week old, because I got a little tiny bit of data tonight, but I'm going to get the full report sometime tomorrow for last week, right? And so if you notice our trends, you can assume that the data that I'm going to get tomorrow shows this continued decline. The other thing that's important for you to know is that the data that I receive, because Mansfield's population its overall population count includes the students on UConn's campus, they break down the data for me so that I can see data among all residents and data among non-student residents. So what I'm sharing with you is data among non-student, student meaning UConn. So these are members of, I guess the way to think of it is year-round members of the Mansfield community. So for the week ending February 5th, for the non-student residents in Mansfield, there were 36 cases of COVID, which presents us with a positivity rate of 7.1. And that positivity rate you hear in the news all the time. But there's another indicator that is looked at the Department of Public Health, and that's your case rate, which is the number of cases per 100,000 residents. You know those maps that you've seen that have the color coding on them? It's the case rate that determines what zone you're in on those maps. So the week ending February 5th, we were at 40.1 in our case rate. Anything above a 15 in a case rate is considered the highest concern and shows up as red on those maps. But a week later, the week ending February 12th, we had only 15 cases, a positivity rate of 5.3, and our case rate had dropped to 16.8, so just barely into the red zone. Again, I don't have the data yet for last week, for the week of February, ending February 19th, but I did get this evening about 5 o'clock. They updated the map on the website, and our case rate for a week ago has fallen now to 10.9, which puts us barely in the orange range, because you'll notice the orange range begins at 11. And so the assumption is that the trend would suggest that when the report comes out for the current week, that we will be in the yellow zone, which means fewer than 5 cases per 100,000 residents. So this is all good news. We have a trend. It's continuing to decline. I put, just as a mark of comparison for you, the Connecticut statewide positivity rate for February 11th, when ours was 5.3. Across the state, it was 4.94. And that is something else we're seeing, that I've watched this virus for 2 years essentially move from New York City across Connecticut west to east, and the eastern part of the state does take a little bit longer, or it's a little bit later before either the cases go up or the cases go down. And so you can see for the week ending February 12th, or the Connecticut numbers are February 11th, we're a little bit higher. I was able to get yesterday's positivity rate, so the rate in all of the state yesterday was 3.51. So again, you extrapolate that, you know, we're probably just over 4%, would be my guess. And again, I'll know more tomorrow. Okay, any questions on that? Okay, so let me show you some more data. So what's happening within the school population itself, in our pre-K to 8 population? The families in the audience will know that, you know, you get a lot of communications from me about what's happening in the schools and how many cases we've seen. Starting the first week of February, we began reporting cases by the week rather than by the day. And we've had different numbers of days in school and different number of count days that our data represent, given snow days and holidays. And so just to share with you the data for the last 4 weeks, including this current week, I included the number of days in the count and the number of cases. So February 4th, we had 4 days where we counted. We had a total of 11 cases. That would be among students and staff in our schools. February 11th, count went up a little bit higher. It was 14, but it was actually data that was given to us from 6 days, explaining the increase. Last week ending February 18th, we had 6 cases, and we were in school for 4 days. And this week, we've been in school only 2 days, but I was expecting more report of COVID cases from the long weekend yesterday, and that's not what happened. We've had only 2 cases thus far. So again, more good news. The numbers in our schools are coming down in the same ways that they're coming down across our community. And then one of the other suggestions was to look at vaccination rates. So the vaccination rates are now reported to us. They're also reported weekly. Again, data are a week old, but it shows the percentage that received the first dose and the percentage that are fully vaccinated. I don't know if they're still giving Johnson & Johnson, but it's a one dose, so it would be considered fully vaccinated if you had that, just to clarify that. But this is also positive data. We continue to see the numbers of children in the 5 to 11 age range, that vaccination rate continues to inch up a little bit every week, where the 12 to 17-year-olds who've been eligible for the vaccine now for a number of months, that number has not changed very much. And that, of course, is primarily students who are high school age. I mean, we certainly have 12s and 13-year-olds in the middle school, but the bulk of those students would be high school. And also interesting to note that 96% of our staff are fully vaccinated. So again, high vaccination rates. I received data for the 10 communities that are part of Eastern Highland Health. Mansfield has continued to be the community at every week that numbers have been reported that have had, Mansfield has had higher vaccination rates among every category in comparison to the other 9 communities in Eastern Highland Health. So other things that I'll encourage you to think about in your deliberations this evening is include that there is still a mask mandate in the town of Mansfield. So the legislation that was put in to place earlier this month allows towns to also impose the requirement that people wear masks in public areas within the community. My understanding is that the town council will take this up again at their February 28th meeting, but when they met on February 14th, they agreed to continue the mandate until they had an opportunity to discuss this in more detail on the 28th. I don't know what they're going to do, but we have been in a mask mandate for some time. I'll make another clarification because this is really confusing. Mansfield instituted a mask mandate in August, just prior to the governor instituting a mask mandate for all schools. When Mansfield instituted their mask mandate in August, we checked with our legal counsel and were told, based on how the executive order was written, that mask mandate that Mansfield was imposing for all public spaces included schools. So even before the governor passed the mask mandate, and this happened within days of each other, but even before the governor passed the mask mandate for all schools, children in Mansfield were going to be wearing masks in schools, as were staff. The new legislation that has extended the executive orders makes a distinction between municipalities and schools. Mask mandates imposed upon municipalities do not include schools, and obviously vice versa. So in order for there to be a requirement that children wear masks in the Mansfield schools, the Mansfield Board of Education must make that decision. So it's not enough to say that the town has a mask mandate. Got it? Okay. The other thing you should know is that masks continue to be required on all school buses because school buses are considered public transportation, and per the Transportation Safety Authority, all riders of public transportation, planes, buses, you name it, must wear a mask. That is in place until March 18th, and we have no suggestion as to whether or not that is going to end on March 18th or whether that will be extended. That is out of our control. So again, if you were to make masks optional in the Mansfield Public Schools immediately, children and riders of school buses would need to continue to wear masks until at least March 18th, until we see what happens then. The other thing that we've been told this week is that the CDC is reviewing their guidance for mask wearing and contact tracing. And there was some suggestion that we would see revised guidelines either this week or next week. It hasn't happened this week. Maybe we'll see something next week. But right now, I think you're all aware that the CDC does still recommend mask wearing in public places. And that we've met with Rob Miller, the director of Eastern Highland Health, who has shared his own statement about how Eastern Highlands is here and ready to support superintendents as we implement the guidance that's been given. And just like he does anytime there's a public health need, he will give us direction, not just support, but direction. So that's another thing that's important to remember, that if there were so if masks were optional and there was an outbreak in the schools, we could be told by the public health authority, which in this community is Eastern Highland Health, that we need to wear masks because of an outbreak. So public health retains some authority when there are problems in a school system. I was explaining that, that we had a water issue one time, and we had to follow Eastern Highlands requirement that we couldn't drink the water or even use it for hand washing. I mean, that's their authority in a community. So not only are they ready to assist us, they're there as an authority body should there be any outbreaks in the future. Okay, so I hope that background is helpful as you have your conversation.
Anyone have any questions or comments? David?
Question.
Into the microphone, please, David. Thank you.
On the numbers of cases, are at-home testing kits reported to the health department for cases?
So that would be up to the individual, whether or not the individual reports it to the health district or reports it to a physician, or in our case, reports it to a school. So if a parent tests a child at home and calls us and tells us that the child's positive, then yes, we report that. We asked Rob Miller that question earlier this week, and he said it's widely understood that we do not know every case because of the amount of at-home testing that's going on. But we never knew every case, is what he said, because we always had asymptomatic individuals. And even at the beginning of the pandemic, it was suggested that for every case, I believe he said, for every case that was reported, we could assume there was another case active in the community.
Then we could assume that 10.9 could be much higher
Could be.
because people haven't reported, and UConn students and their friends coming and going could make it even much higher. So we have a certain percentage of numbers that could be higher.
Yeah, every community
Mhm.
does.
Thank you.
Anyone else? All right. Thank you very much, Kelly.
You're welcome. I'm going to stop sharing the slides if you don't need them any
Jill,
longer.
do you have the speaker list, please? Now I'd like to invite folks.
Did you want to have conversation first?
Oh, I apologize. No, I don't want to have it. I don't want to
Actually,
have.
Kathy, could I ask a question?
Certainly.
Will we have an opportunity to speak again after the public statements?
I'm sorry, say it again.
Will we have the opportunity to speak after the public?
That's what we're going to do. I'm sorry, I should have explained it. I'd like to hear from the public before we deliberate. I think it's important we hear what they have to say. So, yes, Martha.
I just had one other question about the at-home testing. So all the students in our school system have at-home kits.
So we've had 2 distributions of kits. Each time we received any kits, I sent a letter home to parents saying, we have kits. If you need them, let us know and we will give you some. We still have kits. So I'm hoping that means that our families all feel they have access to kits.
Okay, I just didn't know if children under a certain age would be allowed to carry that home in their backpack.
Oh, yes. Mm-hmm.
They are
Yep,
permitted
yep.
to.
Yeah, there's
do
no
that.
there's no like chemical of any concern, I don't think, in them. In fact, the 3rd distribution that we're due now to get next week, it's likely that what we will do is send 2 kits home with every child. So whether parents ask for them or not, they're going to get 2 kits for every child.
Any other questions? All right then. The board welcomes comments from the public. When you approach the board, you can sit right here and use the microphone if you would, please. Please state your name and address, and you will have 5 minutes. So first we have Jen.
Hey, Jen, when you come up, would you pull that mic all the way up to you? Yes,
Is
thank
it
you.
on?
And is the green light on?
Now on.
Okay. You really need to speak right into it. Thanks.
Oh, goodness. Okay. Hi, I'm Jen Zugrazo, 36 Clearview Drive, Mansfield. I'm a town resident, I'm a parent, and I'm also a teacher. The data that you've shared has been great. My biggest concern is things are going really well, and the kids are doing really well with the masks, and it was hard at the beginning, but they understand it keeps them safe, and it has been keeping us safe. So we've had to change our whole way of how we teach kids and how we work with kids. And one of my biggest concerns is if we take the masks off, are we then going to have to separate again? And I mean, right now we're having silent lunch because we have our masks off. Are kids with no mask going to be able to talk without a mask? I mean, there's a lot of different questions we have about what are the implications of not wearing a mask in our classrooms. One of the things that I thought was going to be very difficult is I teach a language, and not seeing my face I thought was going to be very difficult for my students, but they're very adaptable and flexible, and they've been able to figure things out, and I've been able to figure things out in a better way to express myself so that they can understand what's going on. So I think when a lot of people say, well, kids can't understand the teachers, or they're not feeling like they can be heard, I don't necessarily feel like that's the case. So I hope that when we think about making this big change, we think about all the implications that go into making this change and what that will mean in the classroom, what that will mean for the students who want to keep their masks on, the students who don't want to keep their masks on. What's the plan going forward? So right now, I feel like we have a normalcy with our masks where we can get together in small groups, we can collaborate, we can turn and talk, we can have the conversations that we used to have. And I'm just worried about taking them off and then having to go back to, you have to be this far away. So thank you.
Thank you very much, Jen. Jordana?
Good evening. I'm Dr. Jordana Frost. I reside at 687 Browns Road here in Mansfield. I am a parent of 2 school-age children here in town and a spouse of a teacher in the local area. I'm a public health professional. I value data-driven and community-informed approaches to risk mitigation. I also approach public health with a strong focus on health equity, which is when everyone has the opportunity to be as healthy as possible, regardless of socioeconomic or sociodemographic background. To add another layer of identity, I am a member of the rare disease community. I have close family members who are considered by the CDC and the medical community to be high risk for COVID complications, even when fully vaccinated and boosted. I'm not alone. With these intersectional layers of my own identity, I come before you tonight to urge you to maintain the mask mandate in our local schools, to protect not only my children and their friends, but also our school teachers and staff, and all of those community members who are immunocompromised. Research published by the Centers for Disease Control and Prevention shows that schools without mask mandates are 3.5 times more likely to experience school outbreaks compared to schools with mask mandates in place. Such outbreaks are not only detrimental to our community members' physical and mental health, but they're also disruptive to our children's education and our families' abilities to balance work obligations and caregiving. The current state of the research does not fully grasp the extent of the long-term effects of COVID infections, and we're not willing to experience these on the backs of our children, the backs of our teachers and our school staff, especially since mask wearing is a minimal, if null, inconvenience compared to the well-documented protective benefits that it poses. Our community's children are resilient and have adjusted tremendously well to mask wearing, thanks to the COVID mitigation interventions that our district has so well implemented so far. We have been able to return to a sense of normalcy within our classrooms. Children have been able to safely sing in chorus again and do group work in person again. Masks, along with the other interventions, are working. I urge you to please maintain the mask mandate until the risk of community spread of COVID-19 is no longer an issue. Thank you.
Thank you very much, Jordana. Next, I have, I'm not sure if it's Erin Anderson or Eric or. I apologize, I couldn't.
Hello. My name's Erin Anderson. I live at 840 Mansfield City Road. To be honest with you, when I signed that piece of paper, I thought I was signing in. I didn't really prepare a speech, but I can say that I have 3 small children, 2 in the elementary school, 1 in a local preschool. My youngest has been going to preschool without a mask successfully for over a year now, with only 1 incident of an outbreak that put him back in school 5 days later. And we've had several family members that have had COVID. You know, we've taken personal responsibility when we're informed of a, COVID case within our, family or friend community that we visit regularly. And then we take precautions. I think, for me, social responsibility is important. And, I do understand that there are a lot of people that have very serious health risks. And, and I don't take that lightly. If we're going to go into a social situation, I make sure that my kids are symptom free to the best of our ability. I communicate that if somebody has a stuffy nose, which is very common outside of COVID, finding out, does anybody have an issue with that? And we could stay home or, they could choose not to go, but we have those conversations. For me, I think that here's a couple things I've noticed with my kids. We moved to this town in the middle of COVID. And my kids had a really hard time adjusting because they weren't able to socially, interact with their peers, and it's affecting my kids. I've had that conversation with many other parents, and the virus is not going anywhere. We're going to be living with this probably forever, just like the flu. And I don't necessarily think that we stop everything, right? I don't think that we just take masks out for everyone. But I do think choice is important. If a parent could have a choice to allow their child to not wear a mask, I think that's really important to kids and to parents. And honestly, listening to silent lunches, not being able to say hi to your friends in the hallway. Those things are actually things that we talk about at the dinner table. I understand as an adult that it's keeping people safe, or, we're just going to try to get through this, but it is affecting our children to have to wear these masks. And I'm worried about how that's going to show up, 10 years down the road in their life, when they're missing out on these key times. So I am a supporter of not continuing to wear masks.
Thank you very much,
Thank you.
Erin. Elena?
Hi, good evening. My name is Elena Schreiber, and I'm also a town resident. I live at 147 Coventry Road, and I'm a mother of 2 children in the public schools. My daughter is a 5th grader at the middle school, and my son is a 2nd grader at Vinton. I'm here to speak in support of continued masking because masking is a simple and effective way to protect our community against the spread of this highly infectious disease. This is an issue which goes beyond just thinking about me and my family. Although my family and I are fully vaccinated and my husband and I are boosted, we continue to wear our masks in public, and we continue to have our children wear their masks in public because we know that we can still be carriers of COVID, and we care about protecting our community. There are children in the public schools who are living with younger siblings who are too young to get vaccinated, or they're living with older relatives who are medically complex or immunocompromised and can't get vaccinated. And there are some children who go to school who cannot get vaccinated through no fault of their own because their parents have made the choice for them not to get vaccinated. Our public schools have done a wonderful job protecting our kids and keeping them safe and healthy, thereby allowing them to continue learning in person with their classmates and teachers, which my family is so grateful for because we kept our kids out all of last year. Both of my kids did remote learning the whole year last year. And we're so grateful that the schools did such an amazing job keeping them safe that we felt like we could send them back to school this year, primarily because we knew that they'd be having to wear masks. So, we really feel like much of the success is due to, in part, increased vaccination, but also masking in school. And despite the statewide lifting of the mask mandate by Governor Lamont, the CDC still continues to recommend, as Ms. Lyman said, indoor masking for all individuals aged 2 years and older, including students, teachers, staff, and visitors, regardless of vaccination status. We are all obligated as parents and adult members of this community to support our teachers, school administrators, and staff in continuing these efforts and to protect the most vulnerable among us to the best of our abilities. And that includes requiring masks in schools during a global pandemic, at the very least, until the CDC changes their recommendation. Thank you so much for your time and consideration.
Thank you, Elena. David?
Good evening. Dave Slicinski, 355 Spring Hill Road. I'm here tonight to speak on the mask mandate. I feel it should be removed. I have 2 kids in the elementary school. When they come home, the excessive coughing, the breaking out of their skin, the living in fear. This is actually, I feel these kids are going to have a generation where they're just fearful. The only time I've taken a break through this whole pandemic not worked is when I had to stay home and quarantine with any time. They had COVID in November with no symptoms. I was in contact with the COVID task force in this town. They took all necessary precautions. Me, my wife, we all had it. I just feel that it needs to be personal choice. Thank you.
Thank you very much, David. Is there anyone else who would like to approach the board? Please come up and join us.
Thank you very much. Thank you. My name is Vince Tyser. I live at 86 Mansfield City Road. I don't know if that's required for me to speak here, but it seemed like everybody else gave their address. So I want to start with the fact that I have a dear close friend of mine who passed from COVID. It's a real thing. We all know this. People have died. People are still dying across this country. It's not over. The case count's going down. And thank you so much. Are you still Superintendent Lyman?
For 4 more months.
Okay. Thank you so much for sharing that information. I really appreciate that. And thank God. It's going down, but it's not done. I also really want to thank this lady right here. And the reason is, I myself am immunocompromised. I was scared to come here tonight. The reason I'm here tonight is not for myself, because I figure that over these next few years, people are going to get this, and they're going to survive it or not. And if these vaccines work on me, they do. If they don't, I'm in some deep stuff, very likely. So I'm not here for me. I have 2 sons. One of them's 5, one of them's 1. And I love my sons more than anything on this planet other than my wife. And I was heartbroken when the vaccine, the push, was pulled back for under 5. Because we were so on the edge, we can't wait to get our young one vaccinated. That looks like it's around the corner. That looks like it's around the corner. Please, COVID-19 is not just about what happens now. It is what happens down the road to these young people, as well as us. The vaccine decreases the risk of long COVID by at least 50%. If we can decrease for the under 5 population the chances of long COVID by 50%, how can we remove these masks now? We have to have the compassion for those who cannot speak for themselves, and that is our children. I want these masks off. But I want these masks off when everybody has had an opportunity to be vaccinated. I really appreciate your time. And thank you so much for having this space for everybody in the community to speak. Thank you all.
Thank you very much, Vince. Is there anyone else who would like to address the board? Come on up, sir.
Good evening. My name is Ben Hoffman. I have 32 Woods Road, Mansfield, Connecticut. We have one son in Mansfield Middle School in 7th grade, and we have a daughter in a magnet school. My whole family got COVID, while my son, who's masked amongst 90% vaccinated teachers, brought it home to us. And we're all fine. So I don't believe the masks work at all. And I know for a fact that the masks on these children and not being able to see other facial expressions and what we normally see, that we've all grown up with, normal interactions with human beings, our children haven't been able to do for the last 3 years. My wife and I have worked straight through this. We've traveled. We've been to California in the beginning of this. We've been to Mexico. Our children have traveled with us. So this fear-mongering is outrageous. And congratulations on your retirement, but I'll be glad that I'm not going to be fear-mongered by you constantly, every week, with these emails. I can make numbers look like whatever you want them to look like. And that's all you're doing.
Excuse me, Ben. We're going to keep the conversation civil.
Yeah.
There's no personal attacks on anyone, and I would appreciate if you'd adhere to that. We're more than happy to listen to your comments, more than happy. But please, let's keep it.
So it's time for our children to have the choice of wearing a mask or not wearing a mask. Enough is enough. Thank you for your time.
Thank you very much. Is there anyone else who would like to address? In the middle, please. I'm sorry.
Okay. I'm going to speak for myself. I'm going to speak for somebody who's been texting me. So Shannon Sion, 795 Stafford Road here in Stores. I have an 8th grader, a 10th grader, and a 12th grader. I know they're all excited about the prospect of not wearing masks at some point. My 8th grader, we just spoke about it last night. He said he does not think it is time yet. And I think that speaks volumes to me. If my children who don't like wearing masks are still thinking it's a little too early, I support them in that. I also have lots of teacher friends who everyone I've spoken to feels the same way. I don't think, I think that the trends are great, and I think that maybe March 18th is another date to reassess, but see what the CDC guidelines are. I think it would be difficult to make masks optional in schools, but still have to wear them on the school buses. So I think those should coincide. So that's me personally. I'm also speaking for Christina Day, who is on Zoom or watching the live stream. She's at 72 Charles Lane in Stores. She has 2 boys in the Mansfield schools. And she is immunocompromised herself. But I'm going to read you what she said. She said, if the State Department of Health, following guidelines recommended by the CDC, find that mask mandates no longer need to be upheld as a general rule and can be decided on a community basis, what reasons are we in Mansfield going to continue the mask mandate? Do we have higher incidences of COVID than the general population of Connecticut? She didn't see Kelly's slides at the beginning. And are we worried about how these kinds of mandates affect our children's soft skills and social interactions that affect their mental health? And again, she is immunocompromised herself. I know she takes health very seriously, but she is of the opinion that it should be a parent and student decision at this point. So her opinion is slightly different than mine, but I did want to make sure I could share that because she said there was no chat feature for people at home. So thank you.
Thank you very much. Is there anyone else? Yes.
Hi, my name is Emma Frost, and I live at 687 Browns Road. So I'm a student. I'm a freshman at U.O. Smith currently, and I have been through this pandemic at the Mansfield Middle School and U.O. Smith, and I have a brother. Oh, sorry. Yeah. So I was saying that I have a brother at Mansfield Middle School currently, and I have experienced a pandemic at both Mansfield Middle School and U.O. Smith. I have felt very protected with what is going on, like what the guidelines are currently, but I do strongly feel that the mask mandate should continue in schools. Throughout talking with friends and just other classmates at school, we have noticed that it's not just about us as students and the staff, it's also about the people who live in the homes of us and also the people in the community. Many classmates live with a grandparent or someone who is at risk, and this decision does not just affect us, it affects all the people who are in our community as well. So I just wanted to say that.
Great. Thank you very much, Emma. Is there anyone else? Come on up.
Good evening. My name's Steve Guyette. I live at 138 Codfish Falls Road. I have 4 sons, 3 of which are enrolled in the Mansfield School District. I don't have a lot of data here, but I thought I'd just share some of my personal experiences over the last 6 months or so. I'm a coach here in town, basketball. I coach a travel team. 6 out of 8 of the boys on my team have had COVID despite the mask policy in school. My oldest son, he's an 8th grader. He's missed 26 days of school, has never once had a symptom of COVID, never tested positive. Think about that. That's 26 math classes. That's 26 social studies classes. And, you know, since we returned to school, we have found that the remote availability for him to participate has really been lackluster. So, you know, he's suffered over this year. As we talk to our kids about masks, I try to encourage them to come and speak today. They're afraid to not wear a mask in school. They don't want to be labeled an anti-masker. And when we talk about, you know, silent lunch being normal, that just blows my mind to think that, you know, you have to sit in silence at lunch and you can't talk to your friends. I mean, that's not normal. So to me, I would ask you all to think about what is the risk we're putting our students in. And my wife and I have thought about it a lot. When we look at the statistics you put up on the slide, I mean, it's easy to interpret those just in a vacuum, but we need a relative comparison. Like, what are the ratios that you showed on that slide in terms of infection rate compared to other communities that may have already taken the step to not wear masks? Those are important things that you all should be considering rather than just looking at one community and one set of data that may show you you're in a certain color. Because I think a lot of people have referenced the CDC here. To me, the CDC research has not been subject to all of the appropriate peer reviews, at least in my reading, that, you know, normal scientific advancement has been subject to. So I guess my point is, I can't make a decision based on the infection rates that you've shown, but from my own personal experience and having seen my kids in school, I think the impact of masks over the long term, you can't really measure at this point. I think it's going to reveal itself over time, whether that's in fear or kids not, you know, developing the social interactions that we all had. I don't know, but I would be comfortable sending my children to school without a mask. I don't think they're at risk of dying of COVID. I don't think that masks prevent the spread of COVID. I have not seen kids wear masks appropriately. They don't all wear those N95 masks that supposedly are the only ones that prevent this. And I've watched as just a ton of kids have gotten infected and, you know, taken the old school approach of staying at home for 2 days and then returning to school when they feel better and they're no longer a risk to someone else. And I would encourage this board to think about that. I think early on in the pandemic, we didn't know. We put these policies in place to protect people. We're almost, 2 years into this now? I don't think the kids are at risk of when they're not wearing a mask. And I would ask for the Board of Ed to rescind the policy of mask wearing, or at least give the option to the students. Thank you.
Great. Thank you very much, Steve. Is there anyone else?
Thank you all. My name is Rob Brandon. I live in Mansfield at 22 Pine Ridge Lane. I'm the father of two children who are pre-elementary school, and my wife is also a teacher at the elementary schools. I agree with maintaining the mask mandate for the time being for many of the reasons that have already been mentioned. I'd just like to add one consideration that I haven't heard addressed yet. Unfortunately, while the vaccine is available to many of us and is protective against severe disease, what we've seen with the recent Omicron wave is that it's really not as preventative against transmission of the current variant as it was against earlier variants. And I don't know when we're likely to see widespread adoption of a vaccine that is effective against transmission of the current and related variants. And until then, the way I see it is masking and social distancing are the interventions that we can rely on, and likely the interventions that are responsible for the falling case counts that we see these days. So I'd prefer not to remove one of the elements that I think is responsible for the improving case counts that we're seeing these days.
Thank you very much, Rob.
Thank you.
Is there anyone else? Please, come on up.
I just want to ask a couple questions to the board.
May I just interrupt for a moment? We, as I mentioned before, we more than welcome comments and input, but this is not a discussion. We will take whatever you have to say, and if some action is needed, I can
I'll put it in a
promise
different
you.
context.
Okay.
So, to my knowledge, the size of the COVID virus is 1.5 microns. If anybody could challenge me on that, go for it. Now, the masks that we're wearing, some are cotton, some are a material like he's wearing, the surgical masks. Now, can anybody tell me if those masks are going to take an airborne particle of 1.5 microns and block it? Now, I could see a gap around his mask. I could see a gap around everybody's mask. It's not a tight seal. So if you're trying to tell me that that mask, the way it's sealed, the size of material that could pass through it is that, then okay, I would go for it, but that's not happening. Also, too, I failed to mention, I have a 4-year-old who's speech delayed. When COVID first broke out, I had taken her to up at UConn to a speech pathologist. Had an appointment, all elective surgeries and appointments gone. That didn't happen. That didn't happen for over a year. Now, eventually we figured out she needed tubes, which didn't take place because we couldn't get in. So now it's gone 2 years of mask wearing, where now she can't read lips. She doesn't see facial features. So now I have a daughter who's almost 5, who's just learning to speak. So that's one of the, take that into consideration, please. Thank you. Have a good night.
Thank you. Anyone else? All right. Thank you, everyone, very much for your input. I think we can all agree that this is not only a divisive issue, but a very emotional one for a lot of individuals. So I do appreciate you coming up and voicing your opinions. So right now I would like to deliberate with the board. We've heard from the public. Let's hear from what our members feel. I'm going to ask Kelly if she wants to go first, since she's in the box thing there.
Sure. There's definitely a lot to digest, Kelly. Thank you for all of the information that you shared. A few things that have been standing out to and bothering me were mentioned by a few different letters we received and by a few speakers tonight. But I do have concerns over the fact that we aren't able to vaccinate our 0 to 5-year-old population, and that we have a lot of siblings in the community who are unable to be vaccinated. And then also the immunocompromised population is really challenging as well. I am concerned about the 5-day quarantine that the CDC currently has in place. I know that the quarantine is written that it's supposed to be 5 days of quarantine if you test positive, and then 5 days of mask wearing. I don't know how we would, if we went optional, I don't know how we would enforce 5 days of mask wearing once students or staff return to school. And additionally, I feel like that's a breach of confidentiality if we had a student who had not worn a mask for a long period of time and then had to come in and wear a mask for 5 days. I think that's singling them out as having had COVID. So I have a lot of concerns about that. I know that that guidance had changed because Omicron was spreading so rapidly and the CDC was concerned about, maintaining workplaces. I'm curious if their guidance will change again if more places are moving to optional mask wearing. And then just the teacher hat in me needs to say that as much as parents think that they may have influence over their kids wearing masks in school, and they very well do and might, but when kids are in school, it's their decision if they're wearing a mask or not. So, if there's a kid in their class who's immunocompromised, and like we have kids in our school system who spend a lot of time at CCMC for different treatments, cancer related, rare disease related. If there's a student who cares about their friend and wants to wear a mask in school, that student is going to do that. And same thing with a student who may not want to wear a mask. I don't think that's a teacher's job to know parental requests and then to monitor that within the classroom either. So I just think that's just food for thought. So.
Great. Thank you, Kelly. Anyone else? Jeanette?
Thank you. We've talked about the effect on children, and as a classroom teacher, I understand very well the effect on children. But we also need to recognize that the reason that we have been able to be back in school in the midst of a pandemic is because of our faculty and staff. And we need to make sure that we keep those individuals safe as well. We received a survey of the MEA members, and MEA members, the people in the classroom every day, feel that the strategies for mitigation that we have in place now, including mask wearing, is important to continue as we are moving through this latest wave. I did the math, added up the little pie shapes, and 80% of our faculty want to keep mask wearing. And as we're making these decisions, yes, of course, we need to bear in mind the needs of our children, but we also need to bear in mind the needs of the people who are in the classroom every day with them and have their own health and safety issues. Thank you.
Thank you, Jeanette. Anyone else? David?
I've listened intently to everybody speaking. I have children in the school system. I don't like masks. I don't like having to wear them. People have raised some objections to wearing masks, and I think they're valid objections. However, I'm not concerned just with myself, but with the whole community, with the health of the public. So I'm not comfortable in taking masks off at this moment. I see the numbers going down, and I'm very happy, because I'm going to be really happy when we no longer have to worry about masks and we're vaccinated enough and we've learned enough that we can just do away with it. That'll be great. But I'm not happy enough to want to drop the mask. I want some more time. I feel we shouldn't rush. We're going in such a good direction right now where numbers are coming where we want them to be, but a little more time. Patience. That's what I'm pushing, is for patience. Thank you.
Thank you, David. Anyone else? Martha?
Yeah, I feel that we are on the cusp of success. This virus is extremely dangerous, and knowing that, if you look at the figures, we probably have fewer virus than cases than we do have flu. Now, I'm not comparing the flu to COVID, because COVID is much more virulent, but we are getting super close to success. And the CDC has been our guideline, and I really think to be cautious because it's not just my children I'm worried about. We have a whole town of children, and I think we need to wait for the next guidance from the CDC. I read their material. I have material from Johns Hopkins, and one of the issues is the vaccination among the younger set, and it is controversial whether to wear masks or not. And the chief medical director of Johns Hopkins, Dr. Garibaldi, said he worries about rolling them back because of the vaccination records for young kids are just not up there yet. So I think we need to wait for CDC guidance. And I sympathize with all the directions people talked about tonight, but I really think we need to look to a higher authority. Thank you.
Thank you, Martha. Edith?
I'm not sure how much new I have to add to this, but I guess I want to say that I think what's best is for our kids to be physically in school, that the most damaging situation was for kids to be at home trying to learn remotely. The question of whether to continue masking is very complicated. I've looked at data, read articles, considered points of view, and came away with the knowledge that COVID is still alive and well in our community, albeit at much reduced levels, and masking is effective in significantly slowing its spread if all parties wear them. There are other mitigation strategies, and some of those have been discussed here tonight, but vaccination is, as has been said, not available to our youngest students who could carry COVID home to people at greater risk and perhaps harm people that they love very much. Ventilation is not optimum in our elementary schools, and it's still a little cold to have the windows wide open or teach classes outside. We're all sick of masks. I'm sick of wearing a mask. They have their downsides. It's controversial whether experts disagree on whether and to what extent they're harmful to kids, but we know without a doubt that not being in school impedes their learning and their social and emotional well-being. So I plan to support them carrying on the mask mandate at least until mid-March and reassess at that time.
Thank you very much, Edith. Susanna?
I don't have anything to add that hasn't been already discussed, except for just wanted to thank everyone for being here and appreciate everyone's opinions and their feelings about the subject. This is very difficult, so thank you all for coming.
Susanna, may I ask, do you have a...
I do have a motion.
A feeling one way or the other about...
Oh, I'm so sorry.
That's
I thought
okay.
I was
Just
ready.
curious.
I am just missing cues everywhere. Yes, I support continuing extending our mandate for a few more weeks and revisiting in a few weeks.
Go ahead, Jeanette.
I realize I did not say what I felt we should do going forward. We have a responsibility to all the members of our school community, and because of that, I do concur with the other members of the board that we need to wait until we have numbers that are better and we have more information.
Great, thank you. Martha, please.
Yeah, I would like us as a group to commit to meet at the end of March and revisit this issue. And I know we have a meeting the 17th, I think it is, so maybe even after that, a couple weeks after that or something, so that we get current numbers because they're lagging a week and so forth. And to please bear with us. This is, we've got a lot of kids, a lot of teachers, and a whole staff, and it goes to towns. I mean, I just heard of a the other day who works with an older woman, and her great-grandchild brought it home to her. And so she was in the hospital and a nursing home and so forth. So it has repercussions. And I just want to make sure that we try to consider all points of view. And I think if we can commit to meeting at the end of March to revisit this, we'll have more figures.
I agree with that, but I have a suggestion that we extend this till March 14th, the middle of the month. Well, let's, for instance, say something changes drastically. A month away is a long time for folks who feel we shouldn't be having masks on to begin with. So maybe we can come to a compromise. March 14th, we do have a meeting on March 10th. We could always revisit it then. Just the way things are changing day by day, maybe we can act on this sooner rather than waiting till the end of the month. That's my suggestion.
I just thought the CDC was coming out with something March 18th. Maybe I'm wrong on that date.
March 18th was the
Bus.
end of the transportation safety authorities ruling on masks on buses and planes and such. The information we've been given is that the CDC is reviewing mask mandates and quarantine guidance now, and we thought we would have something from them possibly as early as this week or next week.
Okay, I certainly defer to our chair.
Great, thank you very much, Martha. Oh, hey there. Go for it.
I was just curious if we would have updated guidance as to what they're going to do with the buses by that March 10th meeting.
I can't guarantee that. Nobody has breathed a word about what's going to happen. If I'm remembering correctly, though, the March 18th is a continuation from an earlier deadline. And so, but I don't remember when that was or how quickly or how close to that deadline they were when they extended it. So we've not heard a word about what might happen with buses.
Okay. And then quite a few people mentioned the lack of conversation at recess. I'm wondering, I know that's not mask related directly, but I wonder if there's some mitigation strategies we can look at alleviating in the short term if we're going to keep masks mandatory. And my just suggestion for what Martha and Kathy were talking about is maybe we just have like a standing check-in every 2 weeks or a meeting or something as long as we need to until we decide it's appropriate for them to go optional. So if we decide March 10th that it's not, maybe we have another meeting 2 weeks later before our next board meeting and just kind of keep the pace so that we're keeping everyone informed and we're not waiting full months. I know that might be a lot to ask of everybody, but I would be willing to invest in some time like that.
I agree. I think it would be helpful for us to keep revisiting on a regular basis and keep folks informed.
I agree. I would be willing to do that, and I think that we owe that to all members of our community, students, teachers, community members, parents, to do that. And I just wanted to address the lunch issue. It's my understanding that while the children are eating and are unmasked, then it's a silent period. But as soon as they're done eating, and I don't know about you, but I've seen middle school students wolf down a sandwich in about 5 seconds. But once that period is done, then they're able to put their masks on and have conversation for the rest of the lunch period or recess period.
That's been our practice. So when children are unmasked, the ask is that they not talk because that creates greater risk, obviously. But trust me, I've been in our cafeterias and children are talking with their masks on.
David?
I'm comfortable with revisiting this at our March 10th meeting. And if we need more time, we can talk about it then, once we get some more information.
And
I would be comfortable with
hopefully
that.
we will get more
Has
information.
someone made a motion?
Not yet, but
All right.
we're going to work on that. Please.
I am going to make a motion. I move to extend a mask mandate until March 14th, 2022, to be revisited at the Board of Education meeting on March 10th, 2022.
Do I have a second? Thank you, Edith. Any further discussion? Well, all in favor, raise your hand.
Aye.
Say aye. That looks like it's unanimous, so thank you very much. And once again, everyone, we greatly appreciate your input. Very, very difficult topic. I think it's important that we all take care of each other the best we can. And thank you very much for your input. Greatly appreciate it. Kelly, you have anything else? Are we
I do not.
good to go? Then I will accept the motion to adjourn.
I move to adjourn.
Thank you. Second, thank you, David. Anyone have any objections to adjourning? All right, thank you very